Good morning. I am Professor Rajendra Prasad, Director Medical Education and Professor Department of Respiratory Medicine, Eras Lucknow Medical College, Lucknow. I have been former Director, VALLABH PATEL Chest Institute, Delhi, former Professor and Head, Department of Pulmonary Medicine, KGMU, Lucknow. Today we are celebrating World Lung Day. It is celebrated every year on 25th of September. Purpose of celebrating World Lung Day is to make people aware about the various lung diseases. If you see the statistics, among the common non-communicable diseases are very important, and it is cause for around 74% of all global death. And among the non-communicable diseases, heart diseases, cancer, lung diseases, they are very common. And but lung diseases are very neglected globally as well as in India. Although it accounts for large number of deaths globally as well as in India. If I see what are the common respiratory lung diseases, COPD, among non-communicable, COPD, asthma and interstitial lung diseases are very common in globally as well as in India. Among the communicable are infectious diseases, pneumonia and tuberculosis is very important and very common, at least in India. You know, pneumonia leads to large number of deaths in India every year. And in tuberculosis, last year about 5 lakh people died with tuberculosis. In spite, I always say that tuberculosis is a very curable disease and it can be cured 100%. So, what you have understood that lung diseases are very common, but unfortunately it is neglected. That's why this World Lung Day is celebrated each and every corner of the world, including in this country, so that the people, the government and everyone responsible for these processes should know about the importance of lung diseases. What I suggest, what is to be done to improve the quality of care, improve the lung health overall? There are certain things I always say. First thing, that increase the public and policy makers awareness about that is very important. Until unless they are aware that these are the very important diseases, it is very difficult to have work with them. You know, air quality, air pollution, you listen a lot about air pollution. So every country, including our own, should see that standards, WHO standards of air quality should be maintained. One of the enemies for lung diseases is tobacco and its products like smoking. So one has to curtail, one has to reduce and ultimately somehow put stoppage to the use of any forms of tobacco. I say that bidi smoking in India, which is very common, it is very prevalent and it is as bad as cigarette smoking. To promote universal access to the quality health care, improve early diagnosis and various respiratory diseases. I see that many of the respiratory diseases, they are diagnosed late, so their prognosis is poor. So early we should do action so that to improve the early diagnosis and various respiratory diseases. Increase education and training especially to the health professionals who deal with the respiratory diseases, and increase research in lung health. Also various common diseases should also be done. I believe these things are we should able to address, and we should address, so that the lung diseases can be reduced, their mortality can be reduced, awareness can be increased, so that our patients can come for their early diagnosis and treatment. Thank you very much.